It's estimated that we walk over 100,000 miles in our lifetime. That's more than 4 times around the earth. It's no wonder why so many people have problems with their feet. We spoke with a leading podiatrist and foot surgeon, Dr. Emmanuel Sergi of Park Avenue Podiatric Care, to learn about a common painful condition. It's called bunions.
A bunion is basically a painful bump found at the base of the big toe, which in time can grow from chronic irritation and cause the big toe to push towards and into the second toe. Women are more likely to develop bunions than men, and if caught early enough, can be treated without surgical intervention. There are many factors that can lead to the formation of bunions. One of these factors is genetics, and many of my patients will usually state that they have a family member with the same condition. Another contributing factor, and as we so often see here in the city, is the wearing of tight, pointy, high-heeled shoes for prolonged periods of time. On an initial visit, a full biomechanical exam is performed and x-rays at the joint and decide which procedure would be necessary to correct the deformity.
Now let's explore slimline bunion surgery.
With the slimline bunionectomy, a small medial incision is placed at the base of the big toe, allowing me to visualize and gain access to the deformity. I will then remove any abnormal bony growth or mass, and if needed, I will reposition the bones that have shifted out of alignment due to the bunion deformity. A screw is then placed in the bone to maintain the correction, which also allows the patient to walk immediately after surgery. The slimline procedure also differs from other traditional surgical techniques in the way that the incision is now closed. I utilize a combination of 2 different skin closing techniques. The first leaves no suture behind that needs to be removed after surgery, and the second prevents shear forces or movement at the surgical site. This is what allows the patient to see virtually no visible scarring once the site has fully healed.
The result to my foot is great. It looks like a whole new foot. It's so great that I'm actually doing my other foot.
You don't need to take another painful step. Park Avenue Podiatric Care can help you return to your active lifestyle pain-free.